The larynx has many functions in the human body: eating, drinking, swallowing, talking, singing, yelling, whispering, and many more. In terms of speaking, the larynx is responsible for the execution of sounds. Within the larynx are the vocal folds, known by some as the vocal cords. When the vocal folds vibrate, we get the production of voice sounds, such as z or v. Voiceless sounds are produced without the vocal folds, such as s or f. You can feel the difference in the vibrations if you produce those sounds yourself. The male larynx is larger than the female larynx, males being an average of 44 millimeters and females being an average of 36 millimeters. The vocal folds are made up of 5 layers of tissue. The deepest layer is a muscle known as the thyroarytenoid muscle. This deep layer makes up the bulk of the vocal folds. The thyroarytenoid muscle is the active element of the vocal folds, while the other layers, such as the superficial lamina propria, the intermediate lamina propria, and the deep lamina propria, provide strength, cushioning, and elasticity. The vocal folds are bands of tissue that can be set into vibration. Adduction is when the vocal folds come together, closing the glottis. During adduction, the vocal folds vibrate as air passes through, producing voice, also known as phonation. During abduction, the opposite occurs, and no phonation occurs as the vocal folds are being pulled apart. The space between the vocal folds is known as the glottis, and the area below the vocal folds is the subglottal region. The layers of the vocal folds are also known as the cover, which is the superficial epithelium, and the primary and secondary layers of the lamina propria, and the body, the third layer of the lamina propria, and the thyroarytenoid muscle. The vocal folds are able to close immediately when there is an intrusion of a foreign matter, such as food or liquid, which is then followed by a cough to expel the hazard. The vocal folds being able to close is also what allows one to hold their breath, important when swimming, or personally, what I try to do to get rid of the hiccups, and it never works. The larynx itself is a musculocartilaginous structure at the superior end of the trachea. The larynx. The larynx has 3 unpaired and 3 paired cartilages bound by ligaments and mucous membranes. The 3 paired cartilages of the larynx are the arytenoids, the corniculates, and the cuneiforms. The 3 unpaired are the epiglottis, the thyroid, and the cricoid cartilages. The arytenoids slide together and adduct to produce voice sounds. They are located on the high back upper surface of the cricoid cartilage, and they are the posterior point of attachment for the vocal folds. The muscles attached to the arytenoids provide both adductory and abductory functions, which help control the degree of airflow by muscular contraction. The arytenoid and the cricoid cartilages articulate with a joint to permit a wide range of arytenoid motion. The corniculate cartilages are located on the superior surface of each arytenoid, the apex of the arytenoids. The corniculate cartilages articulate with the arytenoids and work to allow rotation, tilting, and sliding of the arytenoids. The cuneiform cartilages are located within the aryepiglottic folds, providing rigidity to the folds. The cuneiform cartilages support the vocal folds and the lateral aspects of the epiglottis. The epiglottis is a leaf-shaped protective structure that moves down to cover the larynx during swallowing. During a normal swallow, the larynx elevates and the epiglottis folds down to protect the airway from food and liquid. The thyroid cartilage is the largest laryngeal cartilage, and it articulates with the cricoid cartilage, allowing for a back and forth movement at the joint. The thyroid cartilages protect the larynx anteriorly. The flat sides of the cartilage are called the lamina. The thyroid laminae meet at the midline, the thyroid angle. At the superiormost point of the midline is the thyroid notch. The hyoid bone articulates loosely with the superior cornu of the thyroid cartilage. The cricoid cartilage is a complete ring that rests atop the trachea, being the most inferior laryngeal cartilage. The cricoid cartilage is wide in the front and thinner anteriorly. The inferior horns of the thyroid cartilage attach to the cricoid cartilage. The arch of the cricoid cartilage is located on the thin anterior side. There are two articulatory facets on either side of the cricoid. The cricoid joint is the articulation between the cricoid and the arytenoid cartilages. These joints allow for rocking, gliding, and slight rotation. The rocking actions helps to bring the two vocal folds together, allowing the vocal folds to make contact. The cricothyroid joint is a synovial pivoting joint that allows for the rotation of the two articulating systems, the cricoid and the thyroid cartilages. The extrinsic muscles of the larynx are the thyrohyoid, and the sternohyoid. The thyroid muscle originates at the oblique line of the thyroid cartilage and inserts into the inferior margin of the greater cornu of the hyoid bone. The thyrohyoid muscle either depresses the hyoid or raises the larynx. This muscle is innervated by the fibers from the spinal nerve C1. The sternohyoid muscle originates at the sternum and inserts into the hyoid. Contraction of the sternohyoid muscle depresses the hyoid. The lower functioning is prominent following the pharyngeal stage in swallowing. The sternohyoid muscle is innervated by the ansa cervicalis. An intrinsic muscle of the larynx is the lateral cricoarytenoid. The lateral cricoarytenoid muscles attach to the cricoid and the muscular process of the arytenoids, causing the arytenoids to move forward and medially. The lateral cricoarytenoids originate on the superior lateral surface of the cricoid and insert into the muscular process of the arytenoids. An infrahyoid muscle of the larynx is the sternohyoid. The sternohyoid is a laryngeal depressor. The sternohyoid originates at the manubrium sterni and the clavicle and runs up and inserts into the inferior margin of the hyoid corpus. When contracted, it depresses the hyoid. A suprahyoid muscle of the larynx is the geniohyoid. The geniohyoid is a laryngeal elevator. The geniohyoid muscle originates at the mental spines of the inner mandible, inserting into the hyoid bone at the corpus. When contracted, the geniohyoid elevates the hyoid and draws it forward. The cranial nerve VII is the facial nerve. This facial nerve provides motor activation of the muscles of the face and the submandibular glands. The sensory component of this nerve involves body senses of the ear canal and the skin of the outer ear, as well as taste for the anterior 2/3 of the tongue. Hearing is a key factor to speech production and development. Cranial nerve XII is the hypoglossal nerve. This efferent nerve is responsible for controlling all muscles of the tongue, which is extremely important for articulation. The Bernoulli principle states that given a constant volume flow of air or liquid, at a point of constriction, there will be a decrease in pressure perpendicular to the flow and an increase in velocity of the flow. Bernoulli's principle explains vocal fold vibration as the positive pressure from the lungs forcing the vocal folds open, but the high velocity of air produces a lowered pressure which brings them back together. Laryngeal cancer is an organic voice disorder. Laryngeal cancer is when there are malignant growths affecting the supra, sub, or glottal areas. Causes of laryngeal cancer include, but are not limited to, smoking, alcohol, environmental toxins, reflux, or a combination of these factors. The effect of laryngeal cancer on the voice and threat to the airway depend on the location of the cancer growth. A primary symptom of laryngeal cancer is a persistently hoarse voice. Additional signs are lumps in the neck, broadening of the larynx, pain in the laryngeal area, or difficulties or pain swallowing. Laryngeal cancer can be anywhere on the vocal folds and present with irregular borders or size. If surgery is performed to remove cancerous growths and some layers of the vocal folds are removed in the process, they cannot and will not grow back. Vocal fold paralysis is a neurological voice disorder. Damage to branches of the vagus nerve results in paresis or paralysis of the corresponding muscle. The type of damage depends on the location of the damage on the nerve. Unilateral damage is when one vocal fold is paralyzed, resulting in dysphonia or aphonia and a breathy or hoarse voice. Both vocal folds being paralyzed is life-threatening due to the inability to prevent food and drink from entering the subglottal area and its effects on breathing.